Well, hello there, everyone, and welcome to Raising Indiana, a podcast devoted to the joys and pains of puppyhood. Here we'll cover everything from training to nutrition to care and psychology. We're continuing this week with Dr. Sharon Startup, a veteran dental vet from Knoxville, Tennessee. In our last episode, we talked about at what age you should have your puppy's first dental exam and the importance of canine tooth care. Stinky puppy breath, bad chew toys, and brushing your puppy's teeth are all topics for this week's show. Let's start off with something we're all very, very familiar with, puppy breath. Dr. Startup, I've smelt some stinky breath in my days, but Indiana's is particularly foul. And I know he's not a poop eater. I know that. I'm around him pretty much 24/7. Now, why is that? And more importantly, what can I do about the notorious puppy breath?
Well, the first thing I would do is have someone, either yourself or a trained professional, do a really good oral exam to try to determine if that smell could be coming from something in the mouth. There are other reasons why a puppy could have bad breath, but you want to make sure that there's not, like maybe there's a baby tooth that didn't go away and you've got a severe periodontal pocket between an adult tooth and a baby tooth that's a source of disease, so you want to get that eliminated for sure. That's a possibility. Maybe there's an orthodontic issue that doesn't allow for natural cleaning of teeth. Dogs really sort of naturally clean their teeth by the way that they bite. So they have this sort of scissors bite, and a lot of natural cleaning goes on every time they chew on something. And if you have an orthodontic issue, that can prevent the teeth from doing that sort of self-cleaning thing that they do. You could have, if you had an orthodontic issue, you could have constant trauma of teeth hitting teeth in a way that they're not supposed to be hitting each other, and that could cause periodontal disease. And periodontal disease is stinky, it just is. But there's just lots of reasons that could be true. I think I would have a really, really good oral exam performed.
Every time I go into a pet store, I see these whole rows of canine dental products. Really, are any of them worth a damn?
Yeah, they really are, and I'm really glad you brought that up because the next thing I was going to say is, let's say you go to your veterinarian and the oral exam is normal, and Indiana just needs to have teeth brushed every day. So that's one of the things that you'll want to institute as sort of your daily routine is teeth brushing. And there are many, many good products out there. There is a council similar to the American Dental Society that governs whether these toothpaste and treats actually do what they claim to do, which is reduce tartar and plaque. So you've got two things. You've got plaque, which is that biofilm that sticks to the teeth and is there within hours of your teeth cleaning. You know how you go to your dentist and you get your teeth cleaned and you're like, oh, they feel so great, and then 3 hours later, you have stuff on them again. You sort of rub your tongue on your teeth and you're like, wow, they don't feel so clean anymore. And this is a couple of hours ago that I had my teeth cleaned. Well, that's plaque. So that's the thing that you want to, that's the stuff that you want to brush off of your dog's teeth every day. Because if you don't brush that every day, it becomes calcified by the minerals that are in the saliva, and now it's stuck and really hard to get off. So that becomes calculus. The society that governs whether or not products that are sold, either over the counter or by veterinarians, whether these products are doing what they say they're going to do, is called the VOHC. That stands for Veterinary Oral Health Council. And they have a website. And you can go to that website, and it's updated And if it has received the VOHC seal, then that means that it will do what it's been proven to do what it says it's going to do. So you can get a VOHC seal for plaque reduction, and you can get a VOHC seal for calculus reduction, and you can get a VOHC seal for both. So I would say as you go to the store and you buy toothpaste, dental treats, that you look on your package to see if it got a VOHC seal. And if it got a VOHC seal for both, that's the one that you want. You want the one that's going to get rid of plaque and calculus.
So just to be clear, should I be brushing Indy's teeth and giving him dental treats as well?
So you want to be, brushing is the best thing you can do. That's mechanical removal of plaque with a toothbrush. That's the best thing you can do. The next best thing you can do is give a treat that has an abrasive quality and anti-enzyme quality to it that will reduce plaque and calculus, and those are the things to get that seal. And then the next best thing beyond that would be some of these rinses, additives that you can use, and those can also get a VOHC seal. But brushing is the best. So.
God knows I love Indy, but I've never, ever put that weird little finger prosthetic or attachment on for any of my boys. I mean, it just doesn't seem natural. Didn't nature design dogs' teeth to be self-cleaning?
I mean, it becomes sort of that philosophical question of nature didn't make toothbrushes. Nature didn't really make humans to brush teeth. And, then there's vaccines, and then there are all the treatments that we do. What we do with medicine and science is try to make our lives better and try to live longer with a better quality of life. And we talked about periodontal disease and how it contributes to other diseases. And so it becomes important for human beings to keep their mouth healthy for as long as they can, and we're living longer. And so it's a pretty tall order for me to keep my own teeth clean some days, with all the thing as busy as we can all get. But dogs are living longer too. So, and we fall in love with our dogs, our pets, and we want them to live as long as they can. And so it starts to become part of our charge to also keep their mouth healthy. I understand what you're saying about, well, gosh, is it really natural to brush a dog's teeth? Is it really natural for us to brush our own teeth? We're just all living longer, and we're much, much better at staying healthy and active at extended ages. And that's what medical science has given us, is longevity and a better quality of life.
Now, what shouldn't I be letting Indiana chew on? I mean, are there any products out there that you absolutely don't recommend?
I have a lot of patients that have broken teeth because of things they shouldn't have chewed. And those animals get root canals and extractions. And so what I think probably it's good to talk about what you shouldn't let them chew and why that's important. So anything that's harder than the tooth your puppy should not be allowed to chew. I don't like cow hose. I don't like, nylon bones, and I guess that's a product, but, I don't like toys that are harder than the tooth, because I see a lot of trauma in my practice as resulting from these toys. What I like are the more rubberized toys that you can, if you can stick your fingernail into it and you get a little indentation with your fingernail, then I know that that's soft enough for the teeth. If I can bend it, I know that that's soft enough for the teeth. And so those are things that I would say are okay for your dog to chew. I like toys that, if you've got a dog that that needs to play a lot, needs to chew a lot, and the rawhide chews sort of keep them occupied. Those rawhide chews are actually harder than teeth, and so I don't really think those are recommended. What I would prefer is one of these rubber-style toys. You can put little treats inside of them, and it gives them just a lot to do and kind of a puzzle to figure out, and it keeps them occupied for many hours. The disclaimer that I would put on any toy that you give your dog, so any, let's say you're doing the best thing, and you're giving your dog a toy that's softer than the teeth and all those right things. I still say adult supervision. Don't ever let your puppy chew on something and not be supervised. Because what can happen is they can chew a little piece of that toy off and then swallow it. And now we have a surgery to go in and get that toy out, and we don't want to do that. So watch the way that your dog chews things and make sure that they're not pulling pieces of it apart and trying to swallow it. That's a very, very important thing to remember. So soft things, soft plush toys, rubberized toys, some of these kind of hardish rubber toys that you can bend or indent with your fingernail. Those are all great toys. Stay away from tennis balls. Tennis balls act kind of like an emery board. They actually file the teeth down, and it's not good for dogs at all.
So pay attention to what your puppy's chewing on and don't leave them unattended. Sounds an awful lot like what my people say about me. We'll have one more conversation with Dr. Startup, but next week is a special holiday edition of Raising Indiana. Why, we're talking with Santa himself. And that's all I'm going to say about that for now. Thanks very much to our guests this week, Sheila, our badass producer, and you, our listeners. From Hudson, Indiana, and your big dog, keep the faith and puppy up. And folks, support your local shelter or rescue and learn more about canine cancer at 2milliondogs.org.